Yes, top of the moment to you anywhere where they watch us from. Today, that's Saturday, most definitely the 27th day in the month of November 2021. And like we've been talking a few minutes ago on Top Kokoroku, so Dr. Barth Ufoegbunam in the building to make sure, say, in they give us advice as far as health in their concern. And that Akoko, you don't reach with that till 8:31 9 we day now. Dr. Barth don't be here with me live to continue the one we've been start some weeks ago. Good morning, doctor.
Yeah, good morning, Chief.
How are you there, sir?
I'm fine, thank you.
Our patient in call.
We are good.
And the home front.
We are good, thank you. And yours?
They are spending the money.
Thank you very much. I like that.
Okay, over to you, sir.
Yeah, thank you very much. Good morning, viewers at home and around the world. We're happy to be back this morning on Health Matter. Today we'll be looking at diabetes. Don't forget, last 14th of November, every month, every year, is regarded as World Diabetes Day. And that was commemorated a few weeks ago. The theme of this year's World Diabetes Day was access to diabetes care. If not now, when? Majority of people who are diabetic or who have diabetes across the globe cannot access the care they need. They cannot lay hands on the drugs, the insulin they need for the treatment of this condition. Okay, but we're going to give an overview today of some of the things we have talked about before now, and then we'll lay emphasis today on diagnosis, complications, preventions, and of course, treatment. Okay, now what is diabetes? In a simplified way that each and every one of us can understand, diabetes is a chronic medical condition that occurs when there is absolute shortage of insulin production in the body, or the body is unable to utilize the insulin that has been produced effectively. There are some key points there. When the body is unable to produce insulin in enough quantity, and when the body is unable, the cells of the body is unable to utilize effectively the insulin that the body system has produced. Now, what is insulin? Insulin is a type of hormone that is produced by an organ of the body that is called the pancreas. Insulin does the function of regulating blood glucose in the human body. Pancreas, a little bit of anatomy. Pancreas and physiology here. Pancreas is actually located behind your stomach, at about where you have almost below your left breast or nipple. That's where you have the pancreas located in the human body. And this organ of the body does two major functions. One is the exocrine function, while the second one is the endocrine functions. Exocrine and endocrine. Now, the exocrine functions of the pancreas have to do with the fact that it produces the digestive enzymes that the body needs in the digestion of the food that we eat on daily basis. This include trypsin and chymotrypsin for digestive of protein, lipase for digestive of carbohydrates, amylase for digestion of carbohydrates, and of course lipase for digestion of lipids. It also produces hormones. Talking about the endocrine functions of the pancreas now, two major hormones are produced by the pancreas. One is insulin, while the second one is glucagon. Insulin has to do with regulation of blood sugar in the body, and that is the one that we are looking at today. Now, the major problem in diabetes is the fact that because of the poor processing of insulin in the human body, the blood glucose tends to rise and get into abnormal range. Don't forget, when you eat food, all the major classes of food, they get broken down into smaller and smaller components. The end product of carbohydrate digestion, we have said that before, is glucose or sugar, if you like. While the end product of protein digestion is amino acids. The end product of lipid digestion of fat and oil is lipids. Okay, so that is how the body system breaks down some of these major macromolecules that we eat when we consume all sorts of foods. Now, but the glucose is where we have the issue with respect to diabetes. Now, when someone has diabetes, his or her body system is unable to produce insulin in enough quantities or not at all. If that happens, it gives rise to diabetes type 1. But in a situation where the body produces insulin, but the cells of the body are unable to effectively utilize this insulin that has been produced, we'll start talking about type 2 diabetes, okay, which is largely preventable in 50% of cases. Type 1 is not preventable. Type 1 diabetes usually occurs in children and young adults and teens. And the signs are usually very obvious because it occurs over a period of weeks to months. Unlike type 2, that usually occur in older adults, 45 years and above, signs and symptoms may not be typical. They may be somehow masked, in the sense that someone may have diabetes type 2 and not get to know for many years. One out of 5 persons that have diabetes at the global level is still very much undiagnosed. That means that if 5 people have diabetes, one of them may not have an idea that he or she has diabetes. And that is why it causes a whole lot of damage over time. By the time the person is beginning to realize that he or she has diabetes, he or she may have started having some of the dreaded complications that can come with this medical condition. What are the signs and symptoms of diabetes? But before we go to that, let's recap what we talked about, the types. I've talked about type 1, which is usually caused by autoimmune destruction of a particular cells within the pancreas called the islet of Langerhans. 95% of the pancreas, in terms of mass, actually does the exocrine function associated with pancreas, while only 5% does the endocrine functions associated with the pancreas. Okay? For reasons not yet known to medicine, there is a self-destruction. The body system begins to attack the pancreas for unknown reasons not yet clearly known to medicine. And these cells that are responsible for the production of insulin, the beta cells found in the islet of Langerhans, get destroyed. And when that happens, for such a person to hang on to life, the person will have to depend on daily injection of insulin, which could come in form of insulin injection with a syringe, with a pump, or even an inhaler has been invented. And that is why previously it was described as insulin-dependent diabetes or juvenile diabetes. But not anymore. That description is rarely used now, but of course it gives us an idea of what it's all about. Type 2 diabetes has to do with a situation where you don't have enough. The body is producing, but it's not enough. That's one. Or the one produced by the body, the cells of the body are not utilizing it as they should do, ostensibly as a result of resistance of these cells. That happens in diabetes type 2. The third major one is gestational diabetes, which is found in pregnant women. Women who were previously not diabetic, but on becoming pregnant, they realize somewhere along the line that they have developed diabetes. Oftentimes, this is picked in the course of doing screening for antenatal patients.
Even BP too.
Yes.
Woman will no get BP before. Immediately we
That
get
also
belly,
can happen.
BP goes.
Pregnancy-induced hypertension. Thank you very much, my e-doctor.
Thank you, Jiri.
Now, apart from these major types of diabetes, there are also some other minor types which will not trouble you with their names. But what are the signs and symptoms of diabetes? How can someone know that he or she has diabetes? The signs and symptoms are typical in type 1, and they will include loss of energy, fatigue, frequent urination, frequent thirst. The person keeps drinking water. And of course, the person may be prone to infection. If the person has a wound, such a person can experience poor wound healing.
Yes.
It could affect the sight. The person could have blurring of vision. It could affect virtually all organs of the body. But these signs, like I said at the beginning, are usually very classic in type 1 diabetes. But in type 2 diabetes, they are not yet very obvious. They are not usually very obvious. Why? It develops over a period of years, months to years, before such an individual could realize that he or she has diabetes. And how is that diabetes diagnosed? What are the tests that can be done before one can dictate that he or she has diabetes? They are very simple tests. There are about 3 of them. Okay? Such a person can do fasting blood sugar, which involves checking the blood sugar level when the individual has not eaten, usually done in the morning hours, after the person must have avoided food for at least 8 hours or more. If you have a reading that is within 70 to 100 milligram per dl, you are said to be within normal range. However, if the reading is between 100 and 125 milligram per dl, the person has gone to pre-diabetic stage, the one that is referred to as pre-diabetes. If the reading goes beyond 200 milligram per dl in 2 separate occasions, that is suggestive of diabetes. However, the lower border is 70 milligram per dl. Anybody who has a sugar level of below 70 milligram per dl is regarded as having hypoglycemia. And usually this occurs in people who are on treatment for diabetes, who are taking insulin or some other drugs, oral hypoglycemic agents that are usually used in the treatment of this condition. There is also a third test that can be done, which is called A1C test or HbA1c test, glycated hemoglobin. Usually, the sugar gets attached to the hemoglobin molecule, which carries oxygen in the body. So this test can actually give us an idea of the person's diabetic control over a period of 2 to 3 months behind. So sometimes if we want to have a good picture of someone's diabetic control for people who already have the disease that are receiving one form of treatment or the other, your best bet might be to do HbA1c test. That will give you an idea if this person has been diabetic or not.
Like say person go collect bank statement.
Yes. Now, The readings were shown to us a while ago on the screen, okay? But I resorted to using the milligram per DL and not the millimoles per liter values. Back from where we left it before we went on the break, who gets diabetes? What are the risk factors for diabetes? Okay, the risk factors for type 1 diabetes are similar to type 2, but are not the same. Okay, now for diabetes type 1, the risk factors include, number 1, family history of diabetes.
That's hereditary.
Yes. Number 2, the presence of autoantibodies in the blood in such an individual. Okay? Such an other risk factors for type 1 will include anything that can cause damage to the pancreas. It could be as a result of accident. It could be as a result of infection, usually viruses. Anything that can cause significant damage to the pancreas can actually give rise to type 1 diabetes, because what that means is that the building, the factory that manufactures insulin in the body has been destroyed.
They don't attack them.
Okay? Okay, so infection can do that. Accidents, injuries resulting from accident can also cause that. Also, physical stress that could come from surgical intervention can predispose an individual to type 1 diabetes. What about type 2 diabetes? Of course, the family history will also come in. Overweight, obesity, life of inactivity, sedentary lifestyle are some of the risk factors that can predispose someone to develop diabetes type 2. And that is, of course, why we said that 50% of type 2 diabetes can actually be preventable. Other risk factors that can predispose someone to diabetes type 2 include, for women, people who have delivered babies that weighed 4.0 kg or above 9 pounds, macrosomic babies. People who have had a history of gestational diabetes in time past, that could be a risk factor for developing type 2 diabetes later in life. For women too, people who have polycystic ovary disease, PCOS, can actually have, this can actually predispose them to diabetes type 2. Truncal obesity, when you have obesity that is usually concentrated at the level of the navel, that can predispose both male and female to diabetes. Being a smoker can cause a whole lot of damage. It can predispose anybody. Smoking should be a no-no for everybody who has diabetes. There is also an important association that I would like to talk about at this stage before we go into some of the things that we have seen in the videos that were shown to us a while ago. There is a strong relationship between diabetes and hepatitis B and hepatitis C, hepatitis C infection. There is a strong link between these two conditions. Oftentimes, people who have diabetes and have hepatitis C infection, it could be a double whammy. It could fast track the liver damage in such individuals. For reasons not yet known, hepatitis C infection can actually predispose or fast track liver damage, and it can predispose someone to developing diabetes along the line.
If I will not be asking too much, sir, let me continue a bit. Maybe
So it's also a risk factor. Having hepatitis B infection. C infection, I beg your pardon, not B. Because B is preventable with vaccine. B is not curable, but C is curable. It equally affects the treatment of hepatitis C infection in people who have diabetes. So let's have your question, sir.
No, I want to make a request. If it is possible for us to even look deeply into, if we are able to wrap up with diabetes today, knowing forward that the months now will still there, but come December next week, if we can go into hepatitis, the types, the causes, and possibly if we get treatment, because the thing where we dey hear normally na say no get cure, but we want to actually, if it's possible, so as a request we are placing before you,
No problem.
so that next week we'll know that okay, we are going straight into wetin hepatitis mean and the types.
No, it may not be next week,
Okay,
because
sir.
we already have, we'll be doing substance abuse next week.
Okay, sir.
The one they call ICE, Mburummiri, and
I see the thing, the trend
and what have you. So
The
we are,
trend,
we are
and we
going
have
to,
to be-
we are
yes.
planning to bring in an expert, a consultant psychiatrist, to do justice to that topic. And of course, that has been fixed, but we can always do hepatitis infection some other time. Okay, so because of the strong link that hepatitis has with diabetes, it has also been found to be a risk factor. And lately, COVID-19 too has been found to be a risk factor for the development of diabetes type 2. It has been found out, some reports have shown, or some studies, that a large percentage of people that suffer from COVID-19 developed diabetes either while receiving treatment or shortly after treatment along the line. Okay, so this can all add up to the risk factors that can predispose one to developing diabetes type 2, not type 1. Now, when we talk about, we have OSITA
sir.
from Lagos.
OSITA, good morning.
Morning, sir. Dami.
How are you doing, sir?
Yes, I'm watching on this thing now.
Okay, you have the doctor to yourself.
Yes, now I'm right away. I'm watching this at the WAP.
Okay.
Thank you very much, sir.
I don't know how I can. It's not what I can. I don't know how I will get in touch with him. So a personal talk.
Okay. MCR, please, can you help us display Dr. Barth's personal details? There you have it on the screen, Mr. OSITA. You can take your time to write the number down. I think he's trying to get a pen.
Thank you very much.
Okay, thank you, sir.
We appreciate your call, sir. Okay, so
Right on, sir.
yeah, today we said we will dwell more on some of the things we've not been able to touch, and of course that is diagnosis and treatment for this condition. Okay, I've talked about a little bit of how diabetes is diagnosed, okay, in terms of the tests that can be done, okay, but there are additional tests that you can actually do to determine if an individual has type 1 or type 2 diabetes. For type 1 diabetes, you can take such an individual, apart from the fasting blood sugar, the random blood sugar, the HbA1c, sometimes we do 2-HPP, 2-hour postprandial. The person wakes up, okay, and then is given some food to eat, forced to take the sugar level, and the person is given some food to eat. Within a space of 2 hours after eating the food, you check the random blood sugar now, because it's random, because he has had meal, and then you compare the values and see where it falls into. Beyond all these commonly done tests, there are very specific ones that you can actually do to determine if someone has type 1 diabetes or not. For instance, if you suspect someone has type 1 diabetes, you can take such a person's blood to do autoimmune antibody test. Okay, if you find autoimmune antibody test in the blood of such an individual, it gives an idea of the type of diabetes that person may have developed. Of course, I've said that age is a determining factor. The age of individual will actually be a yardstick as well. Apart from that, you can check such a person's urine, apart from checking for glucose, which you can, of course, find in diabetic type 1 and type 2. There will be glucose in such an individual's urine. It's an abnormality to find glucose in anybody's urine, okay? So, but beyond that, for someone who has type 1 diabetes, you may find ketones in the urine. That ketones means that the body is trying to generate glucose from non-carbohydrate sources. It's trying to break down already stored glucose in the body, in the liver, and some muscle cells to generate glucose. And of course, that is where glucagon plays a role. Gluconeogenesis, production of glucose from non-carbohydrate sources. So that can give you an individual that this individual may be having type 1 diabetes. Now, after you have established the diagnosis, you need to look at how to manage such an individual. So management of diabetes could come in a number of ways. It's a multidisciplinary approach that is needed in the management. What that means is that you need a team to manage diabetes, okay? So you need the primary physician, you need the nurse, diabetes nurse instructor, educator, and then you also may need a dietitian to guide such a person. So it's a team management that is required in diabetes. Now, the management could involve pharmaceutical interventions and non-pharmaceutical interventions. Pharmaceutical interventions are the interventions that have to do with drugs and injections. Non-pharmaceutical interventions are the ones that have to do with lifestyle modifications, which of course the one we are going to dwell more on. Now, what are some of these non-pharmaceutical interventions that can be done for somebody who has diabetes? Number one is that such an individual will need to shed weight. We saw a little bit of the care of diabetic foot on one of the videos that we watched a while ago. These are all the things that people who have diabetes will need to do. They are part of the care that you need to give to someone who...
Non-pharmaceutical care.
Non-pharmaceutical, the one that have nothing to do with
Drugs.
use of drugs and injections, okay? For instance, for diabetic foot, anybody who has diabetes should inspect his or her feet daily. It's a routine, is a daily routine for you to inspect your feet. Now, why is that possible? The reason why you need to inspect your feet is because of the fact that diabetes has a lot of complications, which we are still going to talk about. But one of them is peripheral neuropathy. It damages the nerves. It also damages the blood vessels anywhere in the body. And because of this damage that it causes to the nerves, it gives rise to a situation where an individual could step on a pebble or step on a nail, and the nail can actually puncture his or her foot without the person getting to know that he has sustained an injury. So the person may start having bleeding. The person may have a wound that he or she has no idea where or how it came about, because of loss of sensation that can occur as a result of damage to the nerves.
Because I was about to ask Sarah, what is it with diabetes and the toe?
And that is why people's limbs are always, oftentimes, amputated. Sometimes when you go to medical wards in some of the teaching hospitals, you find a lot of men and women who have undergone amputation as a result of complications that arose from diabetes. This is the reason. So that care of the foot is very important. Okay? Now, the way you bathe your feet has to be with lukewarm water, never with hot water. And do not soak your feet inside water for far too long. Do not soak at all, because that can no, not just softening, that can actually bring about dryness of the feet afterwards, which is not good for anybody who has diabetes. Don't forget, diabetes will bring about increased chances of having infection, increased bruisability. From the eyes, you have complications that can affect the eyes. It can bring about glaucoma, cataract, and sometimes blindness. We have said it before, that is responsible to 2 to 3% of global blindness. Okay, so it has complications that can affect the heart. Okay, but we are limiting ourselves to that affects the legs at this moment. Okay, now after bathing, anybody who is diabetic, if you want to apply lotion on your feet, please do not apply the lotion or petroleum jelly in between the digits, interdigital
toes.
cleft. Yes, in between the toes. If you do, that could be a precursor for the development of athlete foot. Keep in mind that anybody who uncontrolled diabetes may have challenges with wound healing. So poor wound healing is one of the complications that can arise. Okay, so we can see some of the pictures. So avoid doing that, and don't dip your legs inside hot water, because you may not know the sensation. You may not actually pick out the sensation because of the impairment of the nerves that supply that part of the body. Also, because of the fact that blood vessels are damaged as a result of diabetes, the blood that gets to the lower extremities of the body have now been reduced. And it is worse off for individuals that smoke, people who smoke. Smoking actually restricts blood flow to the limbs of the body. And that can actually help to promote chances of such an individual developing infection.
Okay, let's take TAJUDEEN from Oyo. Taju, good morning. Good morning, TAJUDEEN. TAJUDEEN, did you? Hey, network. Okay, try call us back, TAJUDEEN. Most definitely, na network na cause that one. You're on smoking, sir.
Yes.
No.
Yeah, smoking for people who are smoking for everybody, not just people who are who have diabetes, is a no-no. Okay. Now, also, I also need to point out that if you have diabetes, you should, for no reason, walk barefooted. Not even in your house. Not even within the confines of your house. You may step on top of broken bottle without knowing that you have done so. People who have diabetes are advised not to wear tight-fitted shoes.
Okay.
They are advised not to wear tight-fitted shoes. Okay. In a situation where you have challenges with wounds, you can see your doctor. You can seek urgent medical help. Because if care is not taken, if that wound is not managed very well, it can actually develop to a chronic leg ulcer, which may be a big challenge getting to solve such a problem. In developed countries of the world, such individuals can actually go and see a podiatrist, okay, doctors who specialize with foot and all the related problems. They're called podiatrists. Okay, so that can happen for people who have such a challenge. Tight-fitted shoes need to be avoided, and then your feet should be always very well moisturized.
Okay.
Okay, at all times. Now, some of the things that you also need to do if you're diabetic is the fact that you need to ensure that you have good cholesterol control. If you're hypertensive.
Okay, sorry to hold you there a bit, sir. Please, let's go on this chicken break, most definitely. When we come back, Dr. Barth is going to continue on those things we supposed to know.
Still on diabetic foot care. Okay, there are some things I actually want to mention. Now, for people who are diabetic, if you want to cut your toenails, let it be after you've had your bath.
Why, sir?
It softens the toenails and it makes it easier. And even in trying to cut your toenails, they should be cut in straight-fashioned manner. Don't trim them into the edges. Don't cut them close to the nail bed. If you do, you may have given rise. Let's take this caller.
Cut. God knows. Good morning, God knows.
Good morning, sir.
What a very unique name.
I like that.
Yes.
Okay, the doctor is here, sir.
Yes.
Go ahead with your question, please.
Yes, sir. You made mention of patients having diabetes, that you shouldn't apply Vaseline in between the toes.
Yes.
So what is the implication of that, sir?
Thank you very much. Thank you very much. Now, the essence or the reason why you should not apply Vaseline in between the toes is that it will make the place wet and predispose that region of the body to developing an infection, like athlete's foot. You see some people in between their toe, they have what looks like a white patch there, that even if you scrub with your sponge during birthing, it does not go away. If somebody is diabetic and has something like that, it could very easily turn to a chronic sore. So we want you to keep that place as dry as possible. Okay, but not to say that we're encouraging you to have dry feet. I've said you should ensure that you use a lotion to moisturize your feet, but do not apply them in between the interdigital clefts. That is what we call it in medicine, interdigital clefts. Still on the care of the foot, I was talking about cutting of nails. Do not cut your nails so close to the nail bed. Do not trim it into the angles, okay, of the toenails. If you do, that can predispose you to developing ingrowing toenail, which could lead to the development of a sore or a wound in the feet for someone who's diabetic. And of course, handling wound for people who are diabetic is a serious issue. Okay, so prevention is always better than cure. And then you also need to wear clean stockings on daily basis. Somebody who's diabetic must not wear one socks for several days. Use one sock per day and ensure that they are dry. Okay? Most importantly, you must equally ensure that you control your blood sugar. And of course, we have said before, smoking is a no-no, because smoking can actually help to further restrict the blood that will get to the feet, thereby, yes, making development of complications, foot complications in a diabetic, that can actually make it fast-track such a process, and we want to discourage that. Okay? That said, these are some of the other things that you need to do. Work on ensure your blood sugar level is controlled, ensure your cholesterol level is controlled, ensure your BP does not go beyond 140/90 if you're diabetic and you have diabetes. And of course, pay attention to your doctor's prescriptions at all times. Okay. It's on that note that we'll be calling it
a wrap on diabetes. Thank you very much, Dr. Barth, for giving us this soft landing on this theme of discussion we've started for weeks.